All right, today I'm going to talk about guided growth appliances. There's a lot of confusion out there about these types of appliances. So what we're going to talk about is what they are and how they might be able to help your child. There's lots of different brands out there on the market, and your dentist might have one type or they might use them all. Here at our practice, we use all the different brands out there. They kind of all have different bells and whistles that might be appropriate for one child versus another. So we're going to start off with the first kind of series. Some people call them habit correctors. And some brands that you might hear are Orthotane or the Healthy Start. You might hear one called MyoBrace, Vivos, or Tooth Pillow. So all of those brand names are there, and each one has a little bit of a different design to it. And so I kind of keep them all stocked here, and when we do our exam and we first start working with your child, we're going to pick one that best suits their needs, regardless of the brand. I'm going to be looking for the style, the shape, what the child needs. So essentially, they're soft appliances, and there's multiple ones here, but you can see they're soft and squishy. They're all made from materials that aren't harmful to the body, so they're medically approved types of materials, so you don't need to be afraid of these. And so we'll start with the Orthotane one. So for this one, this is about the size for a child who might be 4 or 5 years old. I'm going to switch over to a bigger one just so for the camera you guys can see better what all is here. When a child wears this appliance, it's going to help with tongue posture, nasal breathing, and getting all the oral facial muscles on board with proper jaw positioning. And if the child can wear it for about an hour, if you can get longer, even better during the day, and then sleep in it all night long, we're going to really start to see some changes from just this simple use of this appliance. You can see this big kind of lip bumper here, a phalange. What's going to happen is the appliance will go inside the mouth, and when you first put it in, it's going to look really big. So sometimes parents will, when they first get a habit corrector, they're like, oh my gosh, the thing is too big for my child's mouth. That is by nature of the design. We want the child to have to stretch and tone their lips to bring them over the appliance, and that's where we're going to get the lip stretch and toning. So that big flange, that's part of the appliance. Don't worry, we're using it purposefully. One of the other pieces on this one is this little area here where you put the tongue. So we actually want to have the tongue off the floor of the mouth. So we have, I call it the floor. I tell the children to put their tongue on top of that little floor, and there's a little tongue stimulator right here where the tip of their tongue is going to touch. So we're teaching proper tongue posture. This one has some little expansion pads. So as they swallow, their tongue is going to hit these lateral pads. And that's going to help with beginning to get the early starts of palatal development. So we're going to kind of use this tongue and get that tongue moving and pushing, get the lips closed, the cheeks out of the way, get our nose breathing well, and we're going to really watch this child grow and change just from the use of this first appliance in this series. Compliance is key. If this ends up underneath your child's pillow, it's not going to work. If we do not get daytime wear, it is not going to work. So we need daytime wear so we're cognizant of how we're holding our lips, our jaw posture, our body posture, and how we swallow. Then once we nail that, and we nail it for at least an hour a day, and it doesn't have to be consecutive, so you could use it for 15, 20 minutes here or there, in the car, after school, whatever works, and really getting that time in, and that's kind of the myofunctional component, a word that you hear a lot at this practice. Then we're going to work on nighttime wear. We really want to get the child sleeping through the night. That's when a lot of the magic happens. If we're sleeping with the appliance and breathing through our nose, we're going to have great jaw posture, opening up that airway, sleeping well, and getting really great start of guided growth. So that's that first appliance in this series. There's other ones from other companies that maybe don't have the floor. Maybe a child is pretty severely tongue-tied, and we're not going to start with the floor because they can't lift that tongue up yet. This one just has a little tongue tab. So maybe we're using this one. This might be more comfortable for a child who's on that really tight area with their tongue. and we have them place it in. Again, wrap their lips around those flanges. It brings the jaw forward and down. And I have them, when they swallow, be cognizant that their tongue is going to hit that button. Tell them to take their tongue and beep the button. So every time they swallow, their tongue is going to hit that tab. One other one that's in kind of that series is what's called a class 3. So that's for a child who maybe has an underbite, where the jaw is rotating too far forward and the maxilla is underdeveloped. It's a little too small. And this one, they're going to place it in, and the tongue is going to go in this little, I call it the tongue gym. The tongue has to go in there, and it's going to push against the palate. And we're going to start to see a change in the bite. This one can work a lot of magic in class 3 cases, meaning that jaw is rotating over the maxilla. Early intervention with those cases makes a huge, huge difference. This is another class 3 one. This is a really big one, but it's probably good for the camera to see because it's super big. This is from MyoBrace. They're a class 3 corrector. So you can see there's lots of different shapes and sizes for that very early stage where we're just working on tongue posture, jaw position, lip seal, and nasal breathing. The next place I'm going to go to is I'm going to talk about what happens after we use our habit corrector, or our first guide in our series. We're going to go over to, some people will call these tooth positioners or guides. Different companies have different names for them, but you can see there's different slots for the teeth. And those are going to work a little bit different. Once we're kind of in our mixed dentition stage, meaning that our adult teeth are coming in, we want to tell those adult teeth where to go. That's when these guides work beautifully. And so what the child will do is they'll wear it, again, at least an hour, maybe more. With these, depending on their age, they might need to be worn more, like 2-3 hours, and it can be in and throughout the day. And what they do is they bite into the appliance. They actually want to bite and squeeze and hold. They're going to hold that squeeze from anywhere from 30 seconds to a minute. And they're going to kind of almost pump their teeth into the appliance, where they squeeze like this, kind of give it a pump. And what we're going to start to do is tell the teeth that are coming in, that are descending into the arch, where they should go. It also helps with positioning the jaw and continued with proper tongue placement. They're also going to sleep with this in. As they grow, this appliance is going to get changed out for a bigger one. So here we are, guiding the growth to a larger and larger size. And as more teeth come in, the tooth positioners get bigger with more slots for more teeth. Some cases can be completed with just habit correction and guides. Other cases are much more complicated. We'll get into that in a minute. But this is a really great way to use the facial muscles, the tongue, and appliance therapy to work on growth and development.